Yes, I am a new graduate. I just graduated in 2020, so it's been kind of daunting to walk into the operating room, but your surgeon makes you feel so comfortable. My experience with Universal Surgical Assistants has been absolutely wonderful. They assigned me with a surgeon, Dr. Arenborough, and he is a general surgeon. I get to do everything from first assisting him in the cases and getting to see the patients preoperatively. I get to order CT scans, read them, review them with Dr. Arenborough, and then basically be his right-hand man in surgery. So I'm standing right next to him. I get to hold the instruments. I get to close. And I also get to follow the patient post-operatively. So it's a really cool experience because you follow the patient start from finish and you kind of develop this relationship with them and they trust you and it's cool to follow up on the results. The exposure you get with the patient is helpful because you follow them throughout their whole entire course of the surgery. So you get to see them in the clinic, meet them there, get to know them, and then you're able to diagnose them and then see them in surgery and then see them afterwards. So it's good to build that kind of relationship and it builds a good continuum of care with the patient. Yes, so as a new graduate physician assistant, you really kind of are nervous to go into the operating room, but you're paired with a really great surgeon and he basically teaches you everything. He taught me how to hand tie, how to read CT scans, how to hold instruments properly. So I've been with the company for about a year and I feel like a completely different physician assistant, my level of training, and I feel very confident in seeing patients. I am treated very well by Dr. Arenborough. I have gotten to work with some other surgeons as well, and they're all very great, very patient. If you don't know something, they make sure that they teach you everything that you need to know. They challenge you, but don't make you feel silly for asking a question. In the next 5 to 10 years, I believe that physician assistants are going to be an integral part of the patient experience. We are there every step of the way, and the patients kind of feel comfortable having their surgeon and an intimate relationship with their physician assistant that they can relate their questions to, or if the surgeon's not available to answer a question, the physician assistant can. So I think it's going to be very standard to have a PA with every surgeon. My experience with Universal Surgical Group has been absolutely incredible. I've learned so much since I've been here for about a year. I worked with Dr. Arenborough, and he taught me everything that I needed to know about surgery, from the pre-op, reading a CT scan and diagnosing the patient properly, to actually first assisting in surgery, which you don't really get a lot of experience in PA school because it's usually medical students or residents that are first assisting. So you get basically the whole hands-on experience and you're trained step by step. And then post-operatively, you get to round on the patients in the hospital and then see them in clinic. So you kind of get the full picture with the surgery. It's really awesome. This exposure helps because you have a familiar face that you relate to. And so the patient sees their PA along with the surgeon preoperatively, intraoperatively, and postoperatively. So they feel very comfortable and they can trust you to ask their questions and trust you with their care. Yes, I am very satisfied with the level of surgical training that has been provided to us. As a new graduate physician assistant, you kind of feel daunted about going into the operating room, but the surgeon that I'm assigned to, he made me feel very comfortable, and by the end of my first year of working as a surgical assistant, I feel very, very confident. He teaches you how to read CT scans, how to hand tie, how to hold instruments properly, the proper surgical technique. I am treated very well by the surgeons that I work with. They make you feel very comfortable and you get to build a very trusting relationship. They get to know you well, know what your strengths and weaknesses are, and they work with you on that. And so by the end of the day, they try to build up your strengths. In the next 5 to 10 years, I feel like the physician assistant is going to be a very integral and important part of the whole surgical process. We're there from the start to the finish. And so I think that it's going to be very important that a physician assistant is there to assist the surgeon in every way.